Greetings, dear colleagues. My name is Oksana Cherevko. I'm a medical doctor, PhD student at the Department of Neurosurgery and Neurology of Sumy State University. I would like to share the results of our research, formation mechanisms of mental disorders in people living with human immunodeficiency virus. Research supervisors head of the Department of Psychiatry, Narcology, Medical Psychology and Social Work of Kharkiv National Medical University, Doctor of Medical Sciences, Professor Hanna Kozhina, Doctor of Medical Sciences, Professor at Department of Neurosurgery and Neurology, Sumy State University, Irina Mudrenko. The epidemic of human immunodeficiency virus infection affects all social groups of the population, but psychosocial stressors directly related to HIV infection, such as stigma, discrimination, and shame, side effects of treatment, symptoms of HIV infection, and disclosure of the diagnosis influence the deterioration of mental health of people living with HIV. Stigma and discrimination can prevent the timely seeking of psychiatric help. A social stigmatization of HIV infection may affect their adherence to antiretroviral therapy. The purpose of our study was to study the formation mechanisms of mental disorders in people living with HIV. A comprehensive examination of 118 patients diagnosed with HIV infection between the ages of 22 and 61 was conducted at the Sumy Regional Clinical Medical Center for Socially Dangerous Diseases. During the examination of each patient, a psychiatric examination was carried out, anamnestic data were collected, and questionnaires were used. The symptom checklist 19 revised psychological symptoms questionnaire, the back depression inventory, the state trait anxiety inventory. The examined patients were diagnosed with organic mood disorders, depressive disorders, anxiety disorders, disorders related to stress and trauma. The results of the questionnaires confirm the diversity and breadth of clinical symptoms found among those examined. 55.9% of patients had severe symptoms of psychological distress. According to Beck's depression scale, BDI, in the form of mild mood disturbance, 21.2% patients, borderline clinical depression, 12.7% patients, moderate depression, 16.1% patients, and severe depression, 5.9% patients. Patients are characterized by high indicators of personal in 39.8% of cases and situational 56.8%. Anxiety in Spielberger's scale of personal and reactive severity, the state trait anxiety inventory. The results of the questionnaire were considered as non-specific indicators of negative affectivity rather than as characteristic anxiety, since it was previously found that individuals with a depressive disorder had a significantly higher index of personal anxiety than patients with an anxiety disorder. As a result, risk factors for the development of non-psychotic mental disorders were identified. The fact of the disease itself, 32.2%, the uncertainty of the prognosis of treatment, 46.6%, long hospital stay, 5%, material difficulties, impossibility of purchasing medicine 10.2%, lack of family support 23.7%, communication difficulties in the workforce 2.5%, inability to cope with work 4.2%, unemployment 20.3%, the desire to limit the circle of communication to isolation 21.2%. The study has clearly identified the key parameters that significantly influence the development of mental disorders in people living with HIV. These parameters include low levels of education, high unemployment, social isolation, lack of family support, fear of stigmatization, harmful habits, stressful events, and factors related to the detection of HIV infection. Thank you for your attention and the opportunity to participate in such a wonderful scientific event.